Good evening, everyone. Welcome to my IVF Fences and the European Fertility Society. We are back after a short break with some more events and some more topics. And I'm really happy to be here once again with Alice Błaszkiewicz. You can see her right here. Hi, Alice. Welcome back. How are you feeling? And are you ready to discuss egg donation? This time we will talk about Greece. And are you ready to discuss this topic with us today?
So much. Yes, I'm very excited to go into details on egg donation in Greece. Yeah.
Brilliant. Thank you so much for joining us today. And just to let everyone know, Alice Błaszkiewicz, she's the patient advocate at Fertility Clinics Abroad, and she's the best person to discuss anything that is related with looking for a clinic. But not only, she's there to support you throughout your journey and also help you with any questions that you might have before you embark on IVF, but also in regards to choosing, selecting a donor. So we know it's not an easy task to do. So we are here to simply discuss it and answer any of your questions. And before we start, let me remind everyone that this is all anonymous and you can type the questions in the chat. It's also being recorded. So remember that if you'd like, it will be available on our website. So don't hesitate. As you know, we are here simply for you, so you can type the questions anytime. And first, we will start with some questions that I would like to ask Alice so that we can bring egg donation in Greece a little bit closer to you and explain all aspects of that. And first of all, I think it's fair to ask why do you think Greece is a popular destination for patients looking for treatment abroad?
Yeah, I think that's a really good question. So usually Greece is one of the first countries that patients find when they start researching different destinations abroad. It's often recommended on patient portals, Facebook groups, or just in online articles. There are quite a few international clinics in Greece who specialize in supporting people coming from abroad. So they have multilingual staff to support you. They have all the certifications necessary, and they have experience in coordinating the process with patients who live somewhere else, sometimes in Europe, sometimes even beyond Europe. And what makes Greece stand out is the balance between cost and quality. So it is more affordable than a lot of other countries like Spain or US, UK, while still providing a very high quality of medical care. So you will find that the clinics are all certified according to EU regulations. They undergo unexpected inspections from their authorities. They have to first get licensing and accreditation before they can start operating. So it's a safe destination to travel to, and at the same time, it's more affordable for a lot of people. The doctors there, they also often have international qualifications. So they often complete their training in the US, UK, in international settings. Often they provide a more personalized treatment plans to patients. They often go more in depth when it comes to the investigations than what people experience in their home countries. So this all makes Greece have a very positive reputation. Another thing is, yeah, I also think the patient experience is another thing that patients often praise about Greece. So first of all, you get to stay in beautiful destinations like Athens, which can help bring some stress down during the process, make it a bit more pleasant, more exciting to go there. But at the same time, the clinics, they put quite a lot of attention to communicating with you, making sure you know what comes next, you know who to contact if you need support. So that side might feel also more personal than with some clinics in different countries.
Sounds about right. Definitely an interesting approach here. And of course, I think it's also good to mention that it's really easy to travel to Greece as well, right? So there are plenty of ways to do that. So I think that's one of those, again, reasons as well. Thank you for that. And of course, today we are focusing on egg donation. So, who can access egg donation treatment in Greece?
Yeah, this is another reason why Greece is quite popular because they have a liberal, inclusive legal framework in terms of eligibility for treatment. Treatment is available for single women or women in heterosexual relationships until the age of 54, which is much higher than other European
Sure.
destinations. Um, Patients that are above 50, so between 50 and 54, they do need to first apply for an approval with the National Authority for Assisted Reproduction in Greece to be able to start their treatment. But this is something that a clinic can support you with. They will explain how to get this approval, what steps you have to go through. Usually, you will have to submit your passport, your ID, some of the reports from your doctors, gynecologist, as well as a general practitioner, sometimes cardiologist, but a clinic can support you with this process. So as I mentioned, both single women and women in relationships, heterosexual relationships can access the treatment. If you want to go through it with your male partner, then you will need to either have your marriage certificate or a notarial deed signed. But even if you're not married, you can still access that treatment. The treatment is not available to lesbian or gay couples. However, the higher age limit still makes it quite popular for people who are not able to access it somewhere else.
It's true, yeah, because in most countries in Europe, I guess 50 is actually the number,
Yeah,
the age limit. So that sounds about right, even though you have to provide some extra health, how do you call it? Just, some
reports.
sort.
Yeah.
Exactly. Then still you can actually do this. And in some other countries, it's simply impossible, right? Because the age limit is 50. So that's a good point here as well. And so who is egg donation recommended for?
Yeah, so when it comes to who should consider egg donation, usually this is a treatment that is recommended to people who are not able to conceive with their own eggs. And this could be for several reasons. Usually it's because a woman's ovarian reserve is really low, so the doctors wouldn't be able to obtain enough eggs for a successful treatment, or it might be that the quality of the eggs is not good enough anymore, which also is tied to the woman's age. So we know that after the age of 30, especially in late 30s, early 40s, the quality of eggs, it decreases quite drastically for women. And this is why a lot of clinics will suggest egg donation around the age of 40 or in the early 40s. Well, this is a bit individual because every woman will have different test results and will be in a different situation. Generally, egg donation does produce much higher results because the eggs, there's usually more of them. They come from young donors who have been tested and vetted carefully before being accepted. The eggs are usually of higher quality, which usually translates into higher quality embryos and will make your chances of success higher. So I would say women over 40 who have found that their egg count or egg quality has been compromised, women in premature menopause or with a history of previous failed cycles. Yeah, these are usually the strongest indications. But if you have any doubts whether egg donation is the best treatment for you or not, I would recommend getting all your pre-treatment tests completed and then booking a consultation with a doctor, for example, with a clinic that you're considering, like, for example, one in Greece. And then the doctor can explain to you what would be your chances with if you go through Onyx treatment compared to with egg donation. And you can compare those numbers, see how you feel about it. Just so you have a realistic expectation before you start and you know how that will affect your prognosis of success.
Definitely. It's also about the time, right? Because of course, for many years you can struggle and not be able to go ahead with IVF with own eggs. It won't work one cycle after another. So sometimes I think this is might be like, what do you want to do next, right? So this is an important part for this as well. Okay, and you mentioned egg donors, of course. And are you able to tell us, so how do they have like a age limit when it comes to egg donors? How
Yeah,
does it
so in Greece, the egg donors, they have to be Greek residents. They have to be between the ages of 18 and 35. So most often it's women in their 20s, sometimes early 30s. The donors, they often also undergo very thorough screening beforehand. So the standard parts of the screening is testing for infectious diseases, screening for any inheritable diseases, medical history of the donor and their family, chromosome analysis. But then there's also more fertility-oriented tests like the ovarian reserve of the donor. How many eggs would the donor be able to produce? Do they have a clean gynecological history? Have they had any gynecological conditions? The clinics also assess the psychiatric history of donors. They administer tests with psychologists to make sure it's someone that will be able to cope with the stress of going through the egg donation process, and it's someone that is aware of the consequences. So they're being screened psychologically, screened in terms of physical health, in terms of any diseases that they could pass down to their offspring. So they undergo quite a lot of tests. Some also screen for genetic mutations, genetic conditions, and if you have any doubts again about does this clinic do their job with assessing the donors, the information of what tests they need to undergo should be available to you. And it's something you can request. It's something that all of them have to go through, and it might calm your doubts a little. Or if you have any worries about, will the donor be healthy? Will it affect the health of my child? It's good to have a chat with your doctor about it because it might help you feel a bit more confident and know more about how the process looks like for that person who will be undergoing the process.
Definitely, lots of things to keep in mind, and the donors definitely they have to be matched, right, with the recipients.
Yeah.
So this is a requirement.
Yeah, that's correct. So when it comes to the donor matching, usually this is done by the medical team if you opt for anonymous donors in Greece. This is the most common option, and in that case, the doctor will first get all the information from you about your characteristics. So your hair type, hair color, skin color, height, weight, all your physical features. And the doctor will compare it with available donors to find someone who matches you when it comes to your skin type, your ethnicity, your general facial features. They often compare the photos of you when the woman was 20, when the recipient was 20, and then the donor, just to see which one would be the best match. Most of this is done by the doctor. If you do the anonymous egg donation, then you can still find out about the features of the donor. The doctors can still tell you what physical characteristics the donor had. They can't tell you the name or show you photos, but you can still get an idea of what features they had, their blood type, pregnancy history, hobbies, even education or occupation. It's something that the clinic can disclose.
Which is again I'm sure lots of people ask about it, obviously. So thank you for sharing that. Okay, and can you tell us now what are the types of egg donation treatment available in Greece? So you have, I'm sure, lots of options there, right?
So I just mentioned anonymous egg donation, and in the case of anonymous egg donation, the identifiable information is not disclosed to the child after they grow up or to the recipient at the moment of the treatment. So not you and not your child would be able to know who the person that donated was. However, you can still know some of the characteristics and a bit of a background on the person. There's also a second option. This is called eponymous egg donation, and this involves you choosing an egg donor from one of the international egg banks that Greek clinics work with. So this is a good option for people who it's very important for them to be part of the selection process and to have control over it and to be able to choose a donor that they would like to have their treatment with. And this way you can receive more information about the donor, sometimes even see the photos of the donor when they were a child or at the moment as an adult. And you can also choose whether the donor would be anonymous to the child or whether their identity would be disclosed to the child when the child turns 18. So it gives you a bit more agency here. What's important to remember about this type, it's only available for frozen eggs. So if you choose to get an embryo from an egg from an international bank, it will come frozen. So it doesn't allow you to have a fresh eggs like in the case of anonymous egg donation.
Brilliant. Thank you so much. And I think that this is actually a new option still, right? Because I think that in the past, only anonymous option was available. And recently, again, this is something that changed, which is, I think, definitely a good option for some people who are not really okay with anonymous, completely anonymous option, right? So this is interesting.
It does give patients a bit more options, and it's still very important to discuss with a clinic the pros and cons of both, because there will be some differences. For example, with anonymous egg donation, if you want to have a a cycle of fresh eggs, sometimes the waiting times will be longer. For the clinic to recruit a donor that will be similar to you and then go through the stimulation that will have to be synchronized with your cycle. If you choose the eponymous route, then the eggs are usually available immediately. They're already frozen. They will come frozen to the clinic. However, the clinic is not involved in assessing the quality of the eggs, so you will have to check what guarantees, if any, the bank you order from will give you. So there are implications of both, and clinics can advise you which is more aligned with your priorities and your needs at the moment.
Right. And in the meantime, we did receive a question, you see, which are the clinics offering this kind of service?
Yeah, so if you mean, eponymous donation, I'm happy to have a chat with you about which clinics do offer this type of option and also which one of them would be the best fit for you. So I think after this meeting, you will be able to book a consultation with me to receive some more details on the exact clinics.
Definitely, because just to clarify, not all clinics are actually offering this, right? So this is important again to discuss it and of course to see what kind of options you actually also need, right? So this is a good point here. Thank you for that. And what about the costs? Let's talk about costs a little bit. And I would also like to know, so is there a difference in price when it comes to those two options?
Yeah, so overall, for egg donation, the prices in Greece range from 6.5 to 8,000 euros roughly. This depends on the clinic, but also on the package that you choose. So different packages, they guarantee different amount of embryos at the end. They might use different amounts of eggs. So that will impact the cost of the package. It's also important to remember that they don't include the cost of the medication, free treatment tests, or the travel expenses and accommodation that you will have to also cover and include in your budget. When it comes to those two options, Usually it's more clear-cut how much an egg donation with an anonymous donor would cost, because then the entire process is managed by the clinic. They will recruit the donor, prepare her, and then handle your entire treatment. When it comes to importing eggs from international egg banks, the cost that you pay for the clinic is much lower because you don't pay for the donor, but you will also have to pay the egg bank separately for the eggs that you're ordering. So how much it will cost depends on how many eggs you buy and how much the egg bank prices the eggs for. So it is quite individual. From my experience, if you want to use as many eggs as the clinics use, it might be similar cost or slightly more expensive.
Okay, but it's comparable after all
I
in the
would
end.
say it's comparable, yeah, but again, a lot depends on your goals. So how many
Sure.
eggs you would be importing, the features of the donor as well.
Definitely. All right. I think more or less we understand about the cost. And what about the timeline?
Yeah, so the timeline is a bit individual for everyone. It depends on what type of treatment you decide on with your doctor, whether you need any additional procedures or tests beforehand. Usually, it all starts with you having initial consultations with the clinic, first with the coordinator, then with the medical specialist. So, usually, the doctor that will lead your treatment. And you will also need to prepare your pre-treatment tests. So this includes things like ultrasounds, blood tests, sperm analysis, sometimes additional tests like an ECG. So once you have all of those completed and you meet with the doctor to discuss treatment, the next step is to find you a matching donor. You have to confirm with a clinic how much this will take, because in Greece, some clinics are able to match you a donor within a month, but some will need 3 to 4 months, depending on where the clinic is based, what is their donor database at the moment, depending on your characteristics. Because if you have very rare characteristics like green eyes or red hair, which are not very common among Greek women, then the waiting time will be longer for you. So this can vary, but anywhere from 1 to even 4 months.
Okay.
Once you have a donor, then it depends on whether you will have a synchronous egg donation cycle, which means that you and the donor start your medication at the same time. The donor will take medication to prepare her for egg retrieval, and at the same time, you start taking the medication for to prepare you for the transfer. In that case, once it's time for the egg retrieval procedure and also the transfer, you will probably have to stay in Greece for about 8 to 12 days, just so you have some buffer time in case the donor is ready a bit earlier, or in case anything has to be adjusted. So usually 8 to 12 days. However, if you do a cycle with frozen, so eggs that have already been frozen, then it might be as little as 7 days. Or if you're doing a cycle where you've had, for example, a sperm donor and an egg donor at the same time, and you just come for the transfer, you have to stay for at least 2-3 days.
So it's definitely much easier and faster, but of
Yeah.
course it depends again. So yeah, thank you for that. There are some questions. Keep them coming. We will take care of those in a minute. There is a question already regarding success rates. So let's go first with that. So what are the success rates for egg donation in Greece in general, and then if you can just perhaps just try to explain how it works. Okay.
Yeah, of course. So different clinics will mean different things by a success rate. So some see success as, early pregnancy that has been detected. For some, it would be live birth. So it's always important to clarify what is reported in those statistics. With egg donation, usually most of the contributing factors for the success rate is the quality of the embryo. So this means what quality the egg was, and then what quality the sperm was. So here it depends, if you were using your partner's sperm, what was the quality of that sperm? What were the parameters? If you're using a donor egg, usually the quality of those eggs is very high. So it does give you a higher chance than treatment with own eggs. Another part is endometrial receptivity. So the condition of your uterus. Is there anything relating to the uterus that could affect the success of the treatment? Overall, in Greece, the statistics that we see from organizations like ESHRE, so European Society of Human Reproduction, we see statistics like 51, 52% pregnancy rate per embryo transfer across clinics in Greece, across all age groups.
Okay.
And this is still higher than ESHRE reports for the rest of Europe. Still a few percent points higher. So it shows us that the standards of treatment in Greece are up to the European norm or even slightly above it. If we look at the cumulative success rates that clinics report and that organizations report, it's usually closer to 65 or even a bit higher. What this means to you is a different type of story, because actually none of us is this average person. And just because the average success rate is 50 or 60% doesn't really tell you how your treatment will go. So it's important to have this discussion with your doctor at the very beginning and ask them, what chances do I have? And maybe even going in more detail, step by step. How many eggs will be used for this treatment? Considering the sperm parameters, what is the fertilization rate? So how many of these eggs will fertilize successfully? And see what they can tell you in terms of their average fertilization rates, or how the sperm morphology or genetic integrity could affect this. And then how many of those early blastocysts will survive until the transfer, because actually with any type of fertility treatment like egg donation or treatment with own eggs, there's always a drop in the survival of embryos and throughout this process. So you will always start with more eggs than you will have embryos at the end. So it's important to understand this, and it's important to discuss with a doctor. For example, if this round doesn't work, what are the next steps? What would you change? Is there anything that can be done differently with maybe some additional tests that need to be done in terms of immunology, endometrial receptivity, maybe a different medication protocol that could change the results? So it's important to understand how it would work in your specific case based on your treatment history and based on your test results. It's not going to be the same for different patients.
And I think that this is again a very important message for everyone who listening right now, that you need to ask about your specific situation. Yeah. So average, I mean, success rates can give you an idea, but this is all again just a general number, I guess, right? Thank you so much. And actually, let's have a look, because we did have a question in regards to success rates. Success rate for women above 50, and after how many cycles do women above 45 have a live birth? Anything you can
Yeah,
provide?
so when it comes to egg donation treatment, the age of the recipient is not as an important of a predictor of success. The As I mentioned, 80% of the contribution is usually going to be the quality of the embryo. So the quality of the embryo will be affected by the quality of the eggs and the quality of the sperm. Your eggs are not being used, so your age is not as big of a factor. However, this clinic still has to check for the endometrial receptivity. So we actually see that the success rates for women doing egg donation at about 50 and even, let's say, 45, it is still comparable because we're still using eggs from a younger donor.
Yep. So this time, actually, age is not your enemy, right? So this is an important message because, of course, when it comes to IVF with own eggs, it's a totally different story. So thank you for explaining that. Timothy would like to know, could you explain treatment with frozen embryos in Greece? I bring this up as some people have frozen embryos and others seek treatment with donated embryos.
Okay, so I think what
Embryo donation, perhaps, right?
yeah, I think there's a question about doing embryo donation versus a double donation. So embryo donation or embryo adoption, how some clinics call it, is when a different couple has too many embryos, which they will not be using, and they decide to then donate it to someone else. In that case, the clinic can offer it to a new patient that is interested. Sometimes these donated embryos, they have been created through double donation. So a young sperm donor and a young vetted and checked egg donor was used. Sometimes it was, for example, an egg donor and a male partner in the previous couple. It will be different, and it's also important to specify with your clinic what type of embryos they have available for donation or adoption, where they come from. So in that type of treatment, the clinic will offer you one or two of those embryos, and you will only have to be prepared for the transfer because the embryos are already created. In most cases, these embryos are of very high quality. As I mentioned, they might come from double donation anyway. The difference will be that the features and the characteristics of the donors might not be as closely matched to you as if you were going through double donation, where both sperm and egg donors are matched specifically to you and your features and picked specifically for your case. Yeah, and another difference is cost. So when you're just adopting an already created embryo, the cost is much lower than if you were going through double donation. But then at the same time, you only get one or maybe two embryos, versus if you go for double donation, you can end up with more embryos to potentially give you more chances of having a transfer. And another thing I want to mention is also the availability. So frozen embryos might not always be available at a clinic. It depends on whether other patients have recently donated an embryo, whether that embryo would be even closely resembling your appearance. So you have to check the waiting time, the cost, and also the quality of the embryos that the clinics are offering.
Again, this is a thorough research in a way, discussion with the clinic that you need to when it comes to, you need to ask the clinic, of course, right, to get some more details. Okay, thank you so much. There are some more questions here. Using frozen donated eggs is appealing, but has a lot poorer success rates. Do you offer any guarantees or reimbursements if our embryos aren't created?
Yeah. So when it comes to guarantees, you have to check what packages the clinics are offering. Sometimes you can buy a package that guarantees, for example, 2 blastocysts or 3 blastocysts or even more. This way, you can feel a bit safer about the outcomes of the cycle. When it comes to frozen eggs, research tells us that the quality is not any different to fresh eggs, and there shouldn't be much differences. What can differ is the survival rate after thawing the eggs. So with current technology, this is still very high. So most eggs do survive. Now clinics use vitrification and methods which are very safe for the eggs. So usually the survival rate is around 90%. So since the quality is not any different, what can help increase your chances if you're using donated frozen eggs is to buy more frozen eggs. So this way you have a higher chance of creating more embryos. However, that will impact the cost. So it's important to also compare, because maybe a cycle with fresh eggs will actually allow you to have more eggs used at a similar sort of cost. But the here this will differ, depending on a clinic. Different clinics have different packages. A lot primarily just work with fresh cycles anyways. But those that offer frozen, you have to check how many will be used and if there's any chance of using perhaps more to increase your chances.
Okay. Thank you, Marie, for your question. And Alice, thank you for your help with that. I think it's clear. However, if you have anything else to add, you know what to do. And I also would like to ask you, because there's another question in regards to mitochondrial donation. Do you know whether it's available in Greece? I know it's still experimental.
Yeah.
It's available in some countries, but I think in Greece it's still experimental. I don't think any clinic does it. Yeah, not yet, at least.
That's correct. It's still something that is being tested, and we're not using it commercially yet in Greece or most places in the European Union. So I'm not really aware of where you could access it commercially just as part of your treatment.
This is like experimental, therefore there are some trials, and I think that some clinics there are actually doing that. But of course, for more details, you would need to search. So it's hard to say. I'm afraid so. Thank you so much. And there's another question from Marie. Can I bring my own donor? And I have a family member who may donate, 38 AMH, you can see. And I'm 43 in New Zealand with long-term male partner, lots of failed IVF treatments of my own. Process in New Zealand, long and expensive. Okay, any advice here? How does it work in Greece?
Greece is actually one of the few destinations in Europe where this is possible in some cases. So you can bring a female family member to be your egg donor. There are some restrictions on that, so it's good to first discuss it with a clinic. In general, it is possible, but the family member, she would have to meet all the criteria of becoming a donor in Greece, which means she would have to be under the age of 35. And she would have to pass all the screening and tests that typically donors in Greece are required to take. So in this case, it sounds like the person you would like to bring is above the age limit of being a donor. However, in some cases, this is possible.
Right. Okay, thank you for the clarification. And I don't see more questions, but of course keep them coming. If there are more questions, we are happy to take them and answer them. And in the meantime, I would also like to ask, so we discuss available options, how to select a donor, how they are screened. And we talked about success rate and costs, and how do you prepare then for such treatment? How does it work?
Yeah, so it's important to be in quite consistent communication with your clinic to understand what steps will be required from you at the beginning. It's something that your coordinator, your primary person of contact should explain to you. Once you have all the tests completed, once you do discuss with the doctor how your treatment would look like, you will receive a proposed timeline for your treatment. So you can agree with the clinic when you would like to start. You will receive information of how long it will take them to, for example, prepare a donor or match you with a donor, and you can start planning in advance. So the clinic will also inform you, for example, how to prepare physically. So what dietary changes might be helpful, whether there's any medication you should avoid during this time. Overall, you usually don't have to travel to Greece in that stage unless, for example, a clinic wants to do more thorough examinations, maybe a laparoscopy, or to check if the uterus is in a good condition, or similar investigations. In that case, it might be helpful to travel. but it might also be possible to arrange those tests in your home country. Another reason why people choose to travel ahead of time is to, for example, prepare for applying for the approval that you need above the age of 50. So in that case, it's something that the clinic can support you with on site as well. But if you decide to do all the preparation in your home country, you only need to travel once for the actual treatment, and you will know in advance when this happens. So you can prepare by booking the flights, you can prepare by finding accommodation nearby. The coordinators will often tell you which hotels they work with or where they recommend that patients stay. But this is up to you, so you can still find something, for example, more affordable or fitting you better on your own. The clinic can also help you with booking a taxi from the airport or give you advice on which airport it's best to travel or fly to. So it's something you can discuss with your coordinator. But all this preparation is something you will have to work through on your own.
Okay, that's great. Thank you so much again for your thorough answer. And in the meantime, we did receive one more question. I prefer the idea of a child donor being able to have contact after 18 years old, if they wish. Can the fresh egg donor ever be contacted after 18 years, or only frozen egg donors?
Yeah.
Interesting aspect.
So that's a very good question. So to specify, in Greece, there's those two types of egg donors that I mentioned. One is the anonymous, and here they are usually fresh. So you would get fresh eggs from this type of donor. They're a Greek resident, they're vetted by a clinic, and by law, if you're using a donor coming from an in-house egg bank from Greece, so these are the donors that can have fresh cycles, it has to be anonymous, so the child won't be able to ever know this information. So legally, it wouldn't be possible. It would only be possible if you're ordering frozen eggs from an external egg bank coming from a different country. So in that case, you could choose OpenID, so when the child is able to know the contact information. However, there are some other countries that you could research that offer this option. For example, Denmark or Portugal. There, the egg donors can be non-anonymous, the information can be disclosed to the child, and you can also arrange for a fresh egg donation cycle with them.
It's great to hear there are other possibilities, because as you mentioned, not everyone might be okay with that. So of course, everyone has to choose what's best for them. So thank you for that. And we will be slowly finishing. So if you have more questions, go ahead, type those in. And before we finish, finally, I would like to also ask you something that is we receive quite often: guarantee programs. How to choose the best guarantee program, and how does it work? And do all the clinics actually offer this sort of programs?
Yeah. So most clinics in Greece do offer these types of programs. And the guarantee programs, they usually involve a guarantee of a number of blastocysts, so embryos at day 5 of incubation. So these are the embryos that are ready for transfer. Usually, the most popular type is a 2 blastocyst guarantee program. So if you choose this program, the clinic will use as many eggs to give you at least 2 blastocysts at the end. So this gives you at least 2 chances of having a transfer. This is especially important for people who might have concerns about the first transfer not working out, or maybe a history of previous failed transfers. But the number of 2 is a minimum that most clinics recommend. There's also an option to have a package which guarantees 3 or 4 blastocysts. So in that case, the clinic will use more eggs to make sure you have more blastocysts at the end and more chances to have a transfer. Usually the people that opt for those higher guarantees are people that are also considering siblings maybe in the future, or maybe they're just concerned about the transfer not working out for some reason. Overall, which one is the best for you? I would again discuss it with a doctor, considering your goals. So, how many children you would like to have? What has been your history so far? Have there been any gynecological concerns? Another thing to consider is the quality of sperm, because this will also affect the quality of blastocysts. So, if your male partner that you're going through this treatment with has issues with sperm quality, sometimes the guarantees will not apply to you, and the clinic might actually say that you're not eligible for this guarantee. So it's important to ask them how your test results might impact your eligibility. And maybe if, for example, there's some issues with the quality of the sperm sample, how this should affect how many eggs you should use during your treatment to give you the best chance of success. Um, yeah, so that's about the blastocyst guarantee programs in short. Another thing is it will impact the price quite a lot, because the number of eggs will impact the price of the overall treatment.
For sure. All right, but this sort of guarantee program also give you that peace of mind as well, right? So I think it's also a good point. But obviously, every couple has to look at their options and their possibilities as well, right? When it comes to the costs, even. So thank you so much. I think that we will be finishing for today. And of course, remember that if you have more questions, Alice is available and will be happy to answer any of the questions. And right after we finish, we will be redirected to a website where you can book your own consultation with Alice. There are only 5 questions there, so please fill it in. And if you'd like to discuss anything with her, she's the best person to do that. So don't hesitate. Thank you so much, everyone, for your time, for your questions. Alicja Błaszkiewicz was our special guest. So thank you. Any final thoughts, any final words before we finish for today?
Yeah, I wanted to say thank you for having me again. And if any of you watching would like to have a chat about your situation specifically, I would encourage you to reach out through the forum, and then we can analyze your situation, whether Greece would be a suitable country for you, how the process works, any questions you have, or how to find the right clinic in your case.
Brilliant. Thank you so much. Alicja Błaszkiewicz, patient advocate at Fertility Clinics Abroad, was our guest, and I'm really looking forward to some more events. I know there will be some more events with Alice, so stay tuned. And I just also want to mention that we started at 5 p.m. London time, but we will have another event today at 7 p.m. London time. So we have 1 hour and we will have another event. So I can only encourage you to join us. If you have more questions, we will talk about pre-IVF testing with Dr. Fruchhaufova from Gynem Clinic. So if you have more questions and time, join us in about 1 hour. Thank you so much, everyone. Take care and hope to see you here quite soon. Bye.